So for this week's Wellness Wednesday, News 19's Yvette Sanchez sat down with two speech-language pathologists who are using cutting-edge technology to help their patients relearn how to swallow.
Therapy Achievements in Huntsville has a new non-invasive technology that uses computers and electrodes to help therapists and patients visually see muscle activity.
And this is so helpful to us and the patients because when we're exercising, we need to know, am I doing this correctly? Am I doing this the way the therapist is showing me?
Dysphagia is a medical term that refers to the difficulty of swallowing. Joey Ferris and Jennifer Eglin, speech-language pathologists at Therapy Achievements, say at least 15 million Americans live with the prognosis. Eglin says working on patients with dysphagia is far more complex.
But we have to explain how to do these exercises that are within the throat and or within the mouth, and it's hard to explain to a patient how to do this and to assess whether they're doing it accurately, with good duration, with good muscle function.
But now with the biofeedback, it helps speech pathologists like Eglin and Ferris to measure what a patient is doing and give patients a visual goal.
All right, hard swallow. Good job.
For patients with dysphagia, it's important to do throat and mouth exercises correctly and repetitively. Ferris says whether they're watching the kangaroo jump or looking at a graph, a visual goal helps in many ways.
So if we can increase their confidence and their ability to do the exercises correctly, we're setting them up to really be able to better rehabilitate their swallow function, which then helps them have so much better quality of life, safety of swallow, and comfort with their swallow.
Eglin and Ferris have treated stroke survivors, patients with Parkinson's, multiple sclerosis, and other cognitive conditions. Both agree that visuals are helping these patients more than ever before.
When we can measure it and they see the feedback that they're getting and they have a goal now, it helps them to increase the swallowing function,
leading to consistency, higher repetition, and muscle memory. In Huntsville, Yvette Sanchez, News 19.
Just another way.
Both pathologists say the technology is more engaging, fun, and motivational than the traditional exercises alone, and they're excited to continue working with the system.